Hey everybody, this is Dr. Zee. Dr. Zarinah is here 5 p.m., just a little bit after 5 p.m. actually, I think. But I'm here, been a busy day, busy weekend actually altogether. What's going on. But I am here. It's 5 p.m. It's Sunday. It's October 1st, 2017. And if you've been following me on Facebook or Instagram or any social media outlets, you know that today we're going to be discussing foam roller. What is it? Who is it for? Does it actually really work? You know, kind of what's the hype about it? And I give you a little, some do's and don'ts actually about the foam roller. So come on into the broadcast. You are welcome into Rebound Your Health TV with Dr. Zee. That's me. And I'm going to wait for a few, maybe 60 seconds to 90 seconds to help let everybody come in. Hi, Sakina. Thanks for joining us. Welcome to the broadcast. This is Rebound Your Health TV with Dr. Zee. Good to see you. Thanks for joining us. Welcome to the broadcast. Sharing is caring. Sharing is caring. So please do share this video with your friends or family, someone that you may know that this may be helpful for. This is not just for athletes. That's something I want people to know too. Hey, thank you for joining us. Welcome to the broadcast. Yeah, it's just not just for athletes. A lot of my patients benefit from this, regardless of your health status or your activity status. So definitely foam roller could be something that you just might want to know about. And also the forms that they come in. Foam rollers don't all come in one size or one shape and so on and so forth. So we're going to touch a little bit on that today as well. But I rushed on in here. I just finished trying to do a quick workout. I'm under the weather a little bit if you can hear a little bit of congestion, but we're going to get it done anyway. Okay, so welcome to the broadcast. Share. That way that we can get more people in here, more engaged. You can ask the questions that you need to ask. I can answer any questions live. I do try to get back to the comment section as well, just in case I miss some of the questions during the live broadcast. But indeed, I'm going to try to get that. And so, of course, more people that's here to engage us and to ask those questions and to participate as well. I like this to make to be very engaging, so that, guys, we can definitely all kind of benefit from this, right? So thank you. I see someone else just joined in. Hey, welcome to the broadcast. I can't see your name, but hey, anyway, go ahead and type in and let us know you're here so I can say hi back. And if you get a chance, just invite a friend. When you get in, invite one person or more, but at least invite one person on into the broadcast so they can benefit from the show as well as you. This information, we're going to be discussing foam roller. What is it? Who is it for? Is it really beneficial? What's the hype about it? Should you be using it at all, and who shouldn't be using it, or how should you use it? I've had some don'ts, some things that people have been doing that weren't necessarily beneficial when they used the foam roller, so they gave up on it. So I want to just kind of tie that into, or at least give you a little bit of direction and angle so that you'll know how the best to use that, okay? Hi, Farida. Welcome to the broadcast. Join this Rebound Your Health TV. It's Dr. Zee. I'm so happy to see you here. Welcome to the broadcast. Go ahead and share, invite someone. While I'm waiting on maybe 60 more seconds to officially get started, I'm going to go ahead and share this to the other page that I have as well. That way we're all be in the go. All right. So as soon as you get in here, say hey, and invite somebody to join you with this broadcast today. That way that we can all benefit and be very engaging, and hopefully we'll get as many participants basically, and also share. Sharing is caring. That way hopefully this can be beneficial to more than just yourself, and we can basically be very engaged here, okay? Hey, Dr. Kwanzaa, what's going on? I caught your last broadcast too. Dr. Kwanzaa, MD, is the bomb. If y'all haven't seen her, that's DJ Cold Blue. Please check out her page at Dr. Kwanzaa, MD. She is the bomb. Thanks for joining us, Dr. Kwanzaa. She goes into a lot of the, basically where hip hop meets medicine. And it's so dope. I love following you. Hi, everybody. Welcome. Thank you. Welcome to the broadcast. Hey, Lenny Pooh. Welcome to the broadcast. Mwah. Hi, Nicole. Welcome to the broadcast. Sharing is caring. So come on in, say hey to everybody so we can get going. We're going to talk about foam roller. It's not just for athletes, but if you feel like you're an athlete inside, it is still for you. And even if you're not, I don't care if you're 65 years old, there's going to be some information here today that can be beneficial for you as you're moving forward with your health goals, okay, to hope it's ultimately rebound your health. So definitely keep that in mind as well. Let me see if I can share this to one more. Okay, then we're gonna get going. Let's see, doctor. Okay. All right. Well, I think it's been at least a few minutes. I got in here maybe 3 minutes behind as well, 3 or 4 minutes behind. But I'm here, y'all. I'm definitely here. We're gonna get to this, okay? So again, as you join in, go ahead and share with someone or invite somebody in. The way you can do that is you click invite literally at the bottom of the screen, scroll, or swipe, I should say, and then also hit notifications so that you'll know when we're coming on further. Usually it's gonna be a Sunday, somewhere between actually at 5 p.m. And if there's any different updates, we'll definitely let you guys know, okay? As you guys know me, I am Dr. Zarinah, also known as Dr. Zee, your sports medicine integrative medicine specialist, here to help you with your health goals to rebound your health, ultimately through my concierge practice, telemedicine, private practice, coaching and consulting services, as well as speaking engagements and authoring. That is how we are able to bring you guys pain freedom, get you to the place that you understand that you're the MVP. Hi, Lenny Pooh, I see you're in the broadcast. Welcome to the broadcast. I guess it's a feature that allows you guys to physically join in. So hey there, but that's you guys know me. So we're gonna jump right into it, okay? So ultimately, what is foam roller? The foam roller is this dense object. I'll go ahead and show you a picture. I wanted to, a lot of you have seen this before. You've seen those different kind of brands out there. You might have seen a Marshall, TJ Maxx, any sporting goods section, Walmart, Target, you name it, they have these. And as you can see, they're all different. They're pretty much the same shape, but they have different designs on them. Those designs actually are meant to do something. They're not just for design. They're actually meant to be a little bit functional for the person using it as well. And we'll talk about that in a little bit as well. And if you're joining, just make sure your phones are on mute. If you're into the broadcast itself, just make sure you're on mute so there's not like an extra feedback or whatever that we get sometimes when people join in physically. Okay, so essentially also, so that's what a foam roller is. That's what it looks like, I should say. The goal of the foam roller is almost like a self-massage or self-muscle myofascial release is what they call it. And essentially sometimes when you go to physical therapy, for instance, you may go to physical therapy and it allows you, you get sometimes massages by your physical therapist. But then also sometimes what happens is they may advise you to use certain tools or certain types of devices that's in their physical therapy gym that are going to allow you to do certain things. They're going to try to implement and improve the integrity or improve the flexibility or the range of motion of that muscle that is in question, right? So that's essentially what's going to be happening in that respect. So essentially that's what the foam roller is and what it's meant for. Is to decrease muscle pain, to improve muscle integrity, to improve circulation of the muscle or the connective tissue that's surrounding those muscles. Also to improve muscle recovery. The studies and the research supports that as well. So that's essentially what it's for. So as you can appreciate, even if you're not an athlete, right, you might have experienced, I would say, if you raise your hand if you experience muscle pain. I can raise my hand. I know that I've experienced that. And foam roller has been a friend of mine, quite frankly, and a friend of a lot of people in my family, young and old. It doesn't really matter your age. This is what I was getting at too. So that's essentially what the foam roller is. If you have any questions about my definition, hi, Sharon. Thank you for joining us. Welcome to the broadcast. Hi, Dr. Ashara. Welcome to the broadcast. Hi, Elaine. Welcome to the broadcast. Rebound Your Health TV with Dr. Z. We appreciate y'all joining in. Invite one friend, invite a family member to join us, and we can definitely be very engaged here today, okay? But if you've experienced muscle pain, if you have any questions about how I just defined what the foam roller is, again, for those who are just joining us, I showed you a picture. These are some examples of them, and they look like pretty designs. But those little knots on them are different. How they design the knots on there is really because of how they're going to further either increase or decrease, actually further increase, I should say, the pressure in those different points of the muscle that you're trying to impact. Hi, Dr. Crystal. Thank you for joining us. Welcome to the broadcast. We appreciate your joining us. Sharing is caring. Maybe invite one friend, and hopefully they can get some information from this today as well. So moving on, who is it for? It's for anybody who's experienced or is experienced or has experienced any muscle or connective tissue, kind of tendon ligament type of pain. Typically, my patients, it might be someone who actually can have chronic muscle pain or chronic back pain. You might have a shoulder injury that you're recovering from. And believe it or not, the shoulder itself, for example, you might think it's just this big ball right here. So socket, it is a socket in the ball type of anatomy, if you will, in terms of how the shoulder joint moves. But around that, and what stabilizes the shoulder is actually muscles that surround that. And that's from the front as well as the back. And so we have to make sure that the integrity of those, and if there's any tension or tightness or decreased range of motion because of the injury or because of whatever else is going on, We have to try to improve the circulation, right? We have to try to improve the range of motion, right? We have to try to improve muscle recovery in that area. Hence, again, the the foam roller is an example as something that you could do at home, and you don't have to be in the office per se, or you don't have to be at the physical therapy gym per se to get benefit from it. And it's a fairly inexpensive little device that you can even travel with, which is also why I like it in terms of when I recommend it to certain patients. Okay, so that's a good point there too. Hi, Dr. Dre. Thank you for joining us. Welcome to the broadcast. And hi, Samaya. Thank you for joining us. Welcome to the broadcast. You're here with me, Dr. Zarinah, also known as Dr. Zee on Rebound Your Health TV, and we're discussing today foam roller. And I just went over basically what is it? What does it kind of look like? Gave a couple examples, and what is it meant for? What is it trying to do? And the point is also that it's not just for athletes. Some people get that mixed up in their mind. Another point I like to make is what the different versions of it. When I say foam roller, that's kind of the example I gave was the pictures there. But it also comes in what they call a roller stick. And sometimes they have little knots on them, little knobbies on them. I was going to try to bring that today, but I didn't get back to the office in time to grab that. But I can post a picture of that at the end of this broadcast. And then also, believe it or not, the quote-unquote poor man's version, I've used it when I was home on the road and didn't necessarily have something else. Is people use a roller pin. You know what you need, the dough, because it's kind of like the same thing. And so some of my patients who have very, very difficult time maybe getting up off the floor to do some of the foam roller exercises, but they still want to get the impact of increasing the circulation, improving the muscle integrity, including improving the range of motion. It actually even helps with lymphatic drainage and such. So when you take that roller pin and you roll it over that area that's of the concern, be it like a trigger point or just a muscle pain and ache, that can be very helpful. But that also leads me into my next point. What are the do's and don'ts? And actually, by a raise of hands or a type of, let's say me, you might just type me, let me know how many of you guys out there have actually used the foam roller. I see you guys joining, but I don't see your comments. So if you are commenting, let me see if I can find that. Are you guys commenting to me? I want to make sure I'm getting you guys' comments. You guys have any questions so far? I do see. Did that work? I'm back. Technical difficulties, but we're going to keep it moving. I just want to make sure that I'm actually seeing you guys' questions. So if you have any questions and I'm not catching them immediately, sometimes it's a slight delay. That's just the nature of live TV, being live. But I'm definitely going to try to catch you guys. So that's what I was trying to do just now. Me, definitely. Okay, I see some comments now. Head there. So you have used the foam roller. And if you have any difficulties with it, maybe post in some questions about when you did A, B happened and you kind of got, wasn't sure about if that was supposed to happen or not. Go ahead and ask those questions as well. And then I can kind of shoot down as I'm kind of discussing this, guys, with you. I can answer those questions as well, okay? So but moving on in terms of the do's of foam roller. Not yet, but I sure will after this. Yeah, that'll be great. And let me know how that goes. But some of this information I'm going to tell you right now. Hi, Ty. Welcome to the broadcast. Thank you for joining us. Click share. Maybe invite somebody on in here with you. And we'll get really engaged here. Is it good for hip pain? Yes. In particular, so that I'm glad you asked this, Sakina. Great question. She asked, guys, if you're not reading the comments, is it good for hip pain? Yes, it can be very, very helpful for hip pain. One thing I always have to delineate or figure out when people ask me about hip pain is what they determine or what they define as the hip. Because believe it or not, a lot of times patients and doctors define hip differently. And so the reason that is because the hip joint itself is kind of going when you point toward the groin. So, Sakina, you could message down in the comment section if you mean in the groin area or the outside of your hip, so to speak, or in that buttock area. It kind of depends. That's why you have to be very specific about, we have to be very specific as doctors to make sure that when you say hip, that we're talking about the same thing. But the muscles that support the hip are very important, such as your glutes that around that area, okay? And a lot of times that's where people do get a lot of pain. But even if it's on the outside, with a muscle that we call the IT band, that goes right on the outside, along the outside of your thigh area, that runs down toward the knee on the outside. Also the tensor fascia lata, whatever, fancy word, right? Some of you guys know what I'm talking about because maybe you're really into muscle anatomy. But those of you don't, the word is not as important as just knowing that the outside of the hip, there is a muscle and muscle complex, if you will, that runs down the outside of your leg that gives a lot of people pain and sometimes even symptoms of bursitis, right? And some of you have experienced that as well and asked me about that. And so the foam roller can be very helpful, or the foam, or the roller stick that we talked about. The roller stick can be, if you Google roller stick, again, I'm gonna post a picture of all three of those, the roller stick, a rolling pin, and the actual foam roller at the end of this video so that you guys can benefit from visually identifying also further what I'm discussing here. But the don'ts of it is do not roll it over. I do not recommend you rolling the stick or the roller over any bony prominence. You don't do that because that can be damaging to the integrity of the external aspect of the bone. And then we also don't recommend you rolling it directly over joints. Okay, so really what you're trying to impact. Hey, Kiki, Dr. Thank you for joining us. Welcome to the broadcast. Welcome to the broadcast. You're here about Rebound Your Health TV with Dr. Z. Come on, join in. If you have any questions, go ahead and type in. We appreciate your presence. But don't roll it over any, actual bony prominence or the joint pain, or the joint itself. My hip pain is around the outside, a bit below my belt line. On the outside, thanks. That helps to know. Yeah. Okay. So yeah, again, you still want to. I always caveat with this. Anything I'm saying today is more of a general recommendation or general suggestions about generalizing. So this is not to be diagnosing or treating anybody in particular. I would definitely recommend a further, very specific, comprehensive evaluation and assessment, either through us or whoever is local to you, to make sure that you ascertain the exact area that is in question. But in general, from what you just described, Sakina, yeah, that could be very helpful. The foam roller rolling over that tensor fascia lata or your IT band on the outside. And you can ask us some further questions if you'd like to info us at info@drzarinah.com. So that's info@drzarinah.com. All right. And Dr. Crystal, the don't roll across joints or bony promises. Thank you for typing that in. You guys are rock stars. My MVPs are on point. Yes, love it. Appreciate it. So definitely, anytime you hear a point that I'm making, yeah, guys, go ahead and type that into the comment section. That's really helpful for you, for it to resonate, as well as anybody that's coming in later and they're trying to catch up and maybe scroll through the comments and they'll see what points they hit and what points are really, really take-home points. And that's one of them. So thank you, Dr. Crystal. So that's a don't. Don't roll it over bony promises. Don't roll it directly over joints, okay? The other thing that I would recommend personally is to say, if you're a beginner to foam rolling, don't get the densest, hardest foam roller. That tends to potentially turn you off, and then you don't get the long-term benefits because it was just too dense for a native, right, or a naive muscle that wasn't used to doing it. So I typically would recommend you getting the lower density foam roller if you're going to start doing these, okay? Because again, you'll get a bigger bang for your buck. You'll get the idea of it, and your muscles will be able to take it, and then you can gradually increase to a denser one. So actually, even in our household, I believe we have like a red one. It's not as dense, and then the black one is really dense, which I like because I like it harder than the red one. Okay, so that's what my don'ts are. Okay, don't get the densest one if you're a beginner. Don't roll it over bony prominences like that lower bone between your ankle and your knee is a tibia, that big thick one. And if you notice, if you run your fingers down the front of your leg from your kneecap and go right down, straight down, you'll feel this bony prominence that sticks out. That's your tibia bone, and don't roll it directly over that bone. However, the muscle belly, such as your calf muscle or your quads or your hamstrings, perfect muscles, right? And you want to roll close to the tendon area where it begins to attach to the bone, but not directly on the bone. And I want to say that's probably the biggest thing that I always have to correct in the office when I get questions about if they're doing it right or not. And that's usually one of the biggest things. They say it hurts, either A, because they got the dense one and they weren't prepared for what that means. And I'll have them bring it in. Keep your receipt and bring it in and show me what you got. And I can let you know, fill on it and kind of let you know, no, I think this is too dense, or no, I don't think it's too dense, this is perfect. And then move on from there. So that you know that you're doing the right thing, okay? So I just want you guys to be safe out there. Again, MVPs have that MVP behavior. And for that, you want to make sure that you're very well, thought out and you know exactly what you're doing, right? That's how we're going to get to the top of our game, rebound our health, and ultimately obtain pain freedom, right? So those are our don'ts. Our do's is right over the muscle belly. We talked about that. Our do's is also to get a less dense foam roller if you're beginner. And if you're advanced, of course, sometimes what I also get from my advanced rollers is that they sometimes feel like they didn't get, or they're losing like that first initial, like what they used to get. And that's because they often didn't change their foam roller. So sometimes you have to get a greater density as your muscles are getting used to that less dense one. So that's a good tip for those who you say, oh, I'm rolling already, I love my foam roller. I get a little bit of benefit, but I don't get the benefit that I used to get when I first started. That's a tip that I would often tell you as well. And now for those of you who are listening to me and saying, wait, I don't fit into that category, I can't get on the floor, although we're challenging you to say that I bet you can, and then you just need some modifications of attempting it. But sometimes I do, depending on, again, your medical history and situation. Well, I recommend the roller stick. And then I'll have two fixed ends with the little rolling knobs in the middle of the stick. And you can roll that along, say, whatever muscle belly or issue that you're having, okay? Any questions? Let me read here. Right over muscle belly. If you are a newbie, don't get a very dense roller. Thank you, Dr. HR, for that, for sure. And do get a less dense roller as a beginner. Increased density as muscle strength increases, absolutely. Would this be good to relieve pain from a Charlie horse? Yes, perfect, good example, absolutely. It's actually really perfect for that very purpose, because a Charlie horse essentially is a muscle bundle getting tight, well, in layman's terms, right? But it's getting really tight in that area where the cramping sensation is it, and that's where you want to roll it. Again, not over the joint, not over the actual bony prominence. So yeah, that can be very helpful. Example that I gave you guys earlier in the week, if you were watching Instagram, I guess, and the Facebook page, was some of the professional athletes, and that's exactly why they use it. So their regimen and when I say a stickler like LeBron, such as Tony Parker, such as some of our professional athlete soccer players and hockey players, especially when I was covering with the auditor, like that was a mainstay, okay? That was definitely a mainstay. That is just part of the regimen. They travel with it because it's easy to travel with. It's not big and cumbersome, and it's something that you know you're going to get benefit from. So what we'll do is, in particular after muscle recovery, hence the Charlie horse would be something you're trying to recover and elongate the muscle, improve the integrity of the muscle, elongation of the muscle, flexibility, improving range of motion, improving circulation. Actually, write those down for me too. Improving circulation or blood flow, whichever one you want to put in there. Those actually mean the same thing. Improves lymphatics with your immune system, improves range of motion, improves flexibility, improves muscle recovery. So anything that stands out from what I'm talking, if you guys can hit some of those, go ahead and hit those down. Hi, Sophia. Welcome for joining us. Thank you for joining us. Welcome to the broadcast. Welcome to the broadcast. We're discussing foam roller. It's not just for athletes. It's for everybody. Or essentially everybody. It can be very useful for just about any age group, okay? And I have used it on my little people. They kind of like that too when they're kind of just feeling a little achy. But most people just because they want to participate. They rarely ever have muscle pain. Unless it just, fell off the bed or something. All right. Any further questions? Would this be good? Okay, read that one. Improve circulation and immune system flexibility. Thank you, Dr. Krista. You are a rock star. Thanks, MVPs. Is it good for spinal stenosis? Great question, Akila. So that question is loaded. In general, yes, it can be. But again, spinal stenosis, for those who don't know what that is, in general, it's a narrowing. So you guys see that? Okay. A narrowing of the spinal, either the spinal nerve or the actual spinal cord where it goes through. So you guys see this circle here, right? And essentially the nerve runs through there. As you can appreciate, when I come in here, is all that space around it. But what happens in spinal stenosis is it gets tighter, which means you're almost suffocating and kind of suffocating that nerve that it's supposed to go through nice and easy. But instead of it being like this, which is how you're practically born, when you have stenosis, it gets tighter, which means you basically have poor integrity, or it makes it more difficult for the connections to run through those nerves. So that's essentially what spinal stenosis is. And sometimes when they squeeze it on the nerves, you get what they call radicular pain that shoots down the leg or the arm, depending on if it's spinal stenosis of the neck or spinal stenosis of the back. But in general, that's kind of what it is, just to give you a little backdrop of that question that Ms. Akila just asked about. And so the muscles that surround that are lumbar muscles or lumbricals, both typically, all these little muscles that are really close to the spine. And then as you get away from the spine, further out to the skin area, there's bigger and bigger muscles, okay? Quadratus laborum and things like that. Whatever. Again, some of you kind of know, I try not to get too, scientific with the wording, but essentially those outside muscles, Akila, to answer your question, that are those bulky muscles on the either side of your back, yes, you can use those to improve the integrity in the muscle pain and symptomatology that comes from spinal stenosis. But again, I would recommend typically, depending on, especially if you've never used it before, is to get a less dense foam roller, or start with the foam stick. Okay, there's actually in the commercial or the video that we posted this week in the Instagram and Facebook, there's a woman who had a stick, a roller stick, and she was self-rolling that on her lumbar spine. And it doesn't say exactly what she had, but in her particular case, she had back pain. So what you're doing is rolling it over that area, those muscles in that area. Let me know if that kind of answers your question. Again, you can always reach us at info@Dr.Zarinah for further clarification. But let me know if that answered your question a little bit, okay? Hi, Yana. Thank you for joining us. Welcome to the broadcast. Mwah, mwah, mwah. Sharing is caring. Go ahead and share if you get an opportunity. Somebody in your family or a friend that someone might benefit from this. This is for athletes and non-athletes alike, okay? This is the good info. Do you have a YouTube channel, Dr. Z? I do. Thanks for asking that question, Dr. Shara. Actually, if you go to YouTube and go to YouTube and put in Rebound Your Health TV, you'll get our page with other past videos. And actually, at the end of this video, or this live broadcast, we'll post this broadcast as well to Rebound Your Health TV on YouTube. Okay, so thank you. That is Rebound Your Health TV. Also, you can put in Dr. Zarinah. You'll probably find me, Dr. Zarinah, DrZarinah. But easiest is to put in Rebound Your Health TV. All right, thanks, guys. Thanks for that question. Any further questions? Okay, so we discussed what is it. We discussed what it looks like. We discussed the do's and the don'ts, right? And we discussed how best to use it if you're beginner versus an advanced foam roller. And it is for pretty much any muscle ailment or muscle pain. It even treats trigger points. I don't know if any of you had a trigger point. Some of you might have even experienced trigger point injections. It's not necessarily a replacement for the injections, but sometimes you may have a flare. Or sometimes you can get away with doing foam rolling, right? First, try that first and see and be regular and consistent with that before you go for the injection. I don't try to push injections on people. I do provide them for those, and again, you have to be appropriate. It has to be assess you to determine if that's really appropriate for you. But indeed, sometimes it's an adjunct. So it may be that you're getting the trigger point injections, and then after the trigger point injections, as I always tell you, if anybody hears my voice and you've been in my office, the trigger point injection is not the end-all, be-all. It is the means to an end, okay? So it kind of gets you that kickstart to make sure that we're getting you along the path so that you can do the things that are going to be asked you to do afterwards, such as your stretching, such as your foam roller. But if sometimes you may need the injection to get you to the next point, because without it, you feel like you can't even tolerate the foam roller. You can't even tolerate some of the other things that I'm going to ask you to do. Because again, we're all MVPs in this room, right? If you're listening to me, you're an MVP. You're here, you showed up, and you was ready to gain some information. So you already are MVP. You already have the mindset. So we know that MVPs are not bystanders, and we're not passive learners, and we're not passive people in terms of going to obtain our pain freedom. That's not how we're going to get there, by being passive. So yes, the injections are there, but also the education is going to be there. You're going to become more empowered and educated about how to get there, how to get yourself out of flares when flares happen, when to call me, when not to call me, because you kind of know what to do, as well as the exercises you're going to implement for the rest of your life. And that's not a bad thing. That's like, wow, okay, I know what to do to help myself. I know what to do to obtain pain freedom. I know what to do to rebound my health and to ultimately be the MVP of my life, so that everybody around me will be much better because of it. If you're like a woman like me, I get you guys. I can definitely relate to that because we are basically selfless in a lot of ways, right? We're getting, but you got to get back to yourself. That's really what this is all about. All right, let me go back to the questions, see if we have any questions. Hey. Oh, yeah. Did I miss a question? I'm going to scroll down just a little bit, make sure I didn't miss anybody. All right. All right, guys. So I think that was it, unless I'm missing a question. I don't think I did. But essentially, that's what we have for today regarding the foam roller. It is one of my, I guess, favorite things to empower people about, because either A, you know about it and you're just not sure what to do with it, or if I'm having lupus, I have a lot of flares in my joints and muscles. Thank you. Absolutely. You're positively welcome and thank you for joining us today, and thank you for asking your questions. And again, you can reach us at info@drzarinah.com. Follow us on Facebook as well at www.facebook.com/Dr. Zarinah. And you can also get this live broadcast uploaded. It will be uploaded to Rebound Your Health TV on YouTube, and follow us on other social media as well. It's still at Dr. Zarinah no matter where you look, okay? Also known as Dr. Z. So thank you guys for joining me. Again, as a quick recap, the do's are definitely over muscles, the connective tissue. The don'ts is don't go over bony prominences or over the joints. Don't get the densest one if you've never done it before. The dense foam roller, go with a slightly softer foam roller. There also is roller sticks for those who feel like you can't quite get on the ground and back up without assistance. You also have a stick as well. So those are the do's and don'ts. As far as what it helps, it benefits muscle integrity, range of motion, improves circulation, helps with muscle recovery, also helps with lymphatic drainage actually, in terms of because the connective tissue and lymphatic system are so closely interconnected, as well as I think I said fascia release and flexibility and range of motion. Okay, so those are the things that it benefits. Again, this is not some quack things. The research definitely supports it. And be honest with you, I use sometimes professional athletes as an example, not because they're like the end all, but one, I am a sports medicine doctor, so my experience with that. But if you consider the people who their bodies is their life, right? Their bodies is their livelihood. When you consider those who are the top of their game and they utilize these things, such as a foam roller, such as something so simple, very, fairly inexpensive, but, that gives them ability to be at the peak performance, then I want to bring that information to you guys. You guys are my MVPs in your own life, your own world, so you deserve the same information that LeBron James gets, quite frankly, right? So that's what I'm here to bring to you, no matter what your age is. If you're 65, 55, 25, or 5, this information is relevant for you, athlete or non-athlete alike, okay? So thank you guys for joining us today. Again, I am Dr. Zarinah, also known as Dr. Z, your sports medicine and integrative medicine specialist, here to help you rebound your health through my concierge practice, telemedicine, private practice, consulting, and speech engagements, and other services and products to come to you guys real soon to help you ultimately attain paid freedom. And that's of the physical and the mental. At the end of the day, we have to have both. It's so interconnected. And I love you guys for joining us. Be the MVPs this week and for the rest of your life. Go ahead and go strong, okay? I'm going to be back here next week to continue to motivate you guys. I'll be on social media, continue to motivate you guys, give you tips and tricks, as well as just motivation. This motivation, we all need it, myself included. And any affirmation or motivation, I'm talking to myself too. So love you guys. Thanks for joining us. I'll see you guys next week. Mwah.